understanding challenges of funding. And then the second one is a little bit more about reporting and sharing out. Those are two things that kind of bubbled up for me. So the first thing, both I think Tracy and Diana spoke to a little bit, but if you're getting multiple funding sources, either at the same time or over the course of time where something stops and then it starts again, to what extent do you, from a programmatic standpoint, have control over or even openness to providing feedback to the funders about what might be working, what were your learnings from the past, or how might they be able to connect with other funding sources and initiatives that are going on to try to break down some of those walls? And I guess the other part of that is then how much are you informed by the funder coming in to say, this is our objective, we're trying to meet it, this is the funding we're providing to you. So I want to learn a little bit more about that piece of it. The second piece is about reporting. The 2015 Dietary Guidelines Advisory Committee just came together and they looked at peer-reviewed evidence, but ultimately it was really limited findings in the areas of food access and community healthy food programs. Not to say that's the end-all, be-all, and peer-reviewed published evidence is everything, but it sounds like there's a lot of really good work going on, and you are all trying to measure and report on what's working. But I'm curious a little bit more about the communications and sharing out about what's working, so that people even in the higher up national places are recognizing and hearing all the great work you guys are doing.
I'd like to hear from the panelists what you think works, and if given a blank check from a funder from the city, if Mayor de Blasio tomorrow said, I'm going to commit X kabillion dollars to move this dial forward, because I think one of the things with the food policy work, with the food work in general, I think we've got a little food access, and there's we think it works. There's evidence that it changes what food is available at bodegas, but we also know income is a big factor, and we also know racism is a big factor, and so as to who gets what, and we hear from the community that they don't know how to cook. So all these different little pieces, I'd like to hear from the panelists, what in their dream world all of these groups would come together and say, I want A, B, C, and D, and if we only had the funding for this, we would radically change the way people eat in New York City.
I'm curious about the local trap, just only seeing just beyond you and maybe not being able to reach further than that. So my question is, do you believe that many of you are coming at similar dead ends, and do you discuss these dead ends? And do you think that has anything to do with efforts with health promotion as opposed to regulation, for example? So a lot of the funding that we receive seems like is towards health promotion rather than necessarily regulation and policy level.
Kind of the antennae go up. It's like, what are they doing? And why aren't we working together? And there are networks that we do collaborate across. So for example, part of something called Community Food Funders, which is sort of a network of food funders here in New York, and so we're able to talk among each other about what we're seeing and what the gaps are. But food is an awfully big field and issue, and a lot does come into play. I mean, that food insecurity is a poverty issue. So are we talking to organizations or funders that are dealing directly with income issues, or on the policy side, minimum wage issues? I think there is legitimate concern. I struggle, in conversations with grantees of how much I should say, well, here's what I'm seeing, and wouldn't it be great if you could, look at this, versus not wanting to be prescriptive because I'm not on the ground, and not wanting people to jump through hoops because a funder is saying, hey, if you do this, then maybe we can fund that. And that's just kind of an inherent tension, because we do have a perspective, because we're seeing lots of different programs. We're sort of at a nexus of many different programs, so inherently we're sort of looking comparatively and trying to understand those gaps. So I guess I'll just acknowledge the problem, recognize that there are some positive measures and mechanisms to do that, but would appreciate frankness from grantees when they say, you know, we can't do what you're asking and what Kellogg is asking and what, you know, the CDC is asking, but can we get together and talk about these multiple things?
I've worked on grants, both state and federal, where it's so prescriptive, I couldn't move beyond a silo. So if I was funded to do nutrition education in 4 schools in the South Bronx, that's what I was funded to do. And I couldn't really look beyond the walls of the school to see, you know, what churches are doing youth work. I had to go beyond that on my own. And so when the funding allows you the flexibility to look beyond that, I think that's really advantageous to us on the ground. In terms of what works, I think the question was, what types of strategies work. I think we're all searching for that. I think I've seen some models that have been successful, and I think that entails bringing community forward and lifting those voices. And I think it'll be such a day when this panel, and no offense to anyone on the panel, but this panel looks entirely different in its community voices. And not just picking people off the street because our grant told us to do that. I mean, people we've supported through the years with our funding in order to have the capacity to do the work they need to do to change their communities. I think that would be so powerful. And also, in regards to the emergency feeding example and working in a silo, in East Harlem, when a year ago, you know, there was an explosion not far from Hunter campus, and that happened. You know, all the emergency preparedness folks bumped into one another, and the Red Cross basically just took over. And there was a lot of tensions in the community about that. You know, how could that have been avoided? How do we reduce duplication? And so one mechanism was that was used was the coalition, the East Harlem Community Health Committee came together and said, you know, how do we avoid this in the future? When there's a command call from the top, how do us as the grassroots organizations come together to respond in a timely manner and make sure we're not stepping on anyone's toes? So a very real example, and it happens. And I think looking ahead and doing some of that preparedness work would help.
Fund, so it's a funders collective of 17 different funders, and again it was a realization that we were asking a lot of our community development corporations to do a lot of different things, and if we came together we could jointly as funders decide kind of what is the purpose of or the goals of all of us coming together, and what do we want these groups to kind of focus on. And the goal of that fund is really to try to move the needle on poverty, and for each of our CDC partners to be able to make the business case for their work and collect data to really showcase impact at the end of the day. So what we were able to do is bring 17 funders together, provide $1 million to 5 different CDC partners. New Settlement Apartments in Cypress Hills is both receiving this funding. And they're working jointly on figuring out a database they can use across all of their different programs to show impact on particular residents and individuals, and then really figuring out how they can improve their existing programs to make sure that they're connecting their programs to one another. So I think that's a good model of funders actually coming together proactively.
I mean, I want to be really honest here, but I also want to tell you that we did publish a paper that I felt was the most optimistic paper maybe, which is that Tom Frieden he's the head of the CDC, he used to be the Commissioner of Health, and he has this pyramid, if you haven't seen it, of health, and you can see that obviously changing poverty, you know, education, housing would give you the most bang for your buck if we could change. But he's got education all the way at the top, because you need so much money and so many people to be able to reach the millions of people in New York City the way that you would like. But in doing this paper on fruits and vegetables, I realized that all of us basically merge together in all of our work. As much as there is duplicity, there's also this commonality, and we reach together so many more people than we realize we do separately. And so to me, that kind of pyramid, education all of a sudden becomes half of the pyramid. And it is the promise that we all have, and that we all should hopefully keep us going in terms of all the work that we do, that we are improving the neighborhoods, and that we keep going into new neighborhoods, and that we do talk together, and that we do try even harder to work together.